Got some health news for you. Getting the flu could raise some people's risk of a heart attack. According to a new study out of the Netherlands, people who get the flu could be 6 times more susceptible to suffering a heart attack in the days following the virus. The study analyzed more than 26,000 flu cases between 2008 and 2019. So let's talk more about this with Dr. Jeff Potoff, UW Health's Chief Quality Officer. Great to see you, Doc. So what's your takeaway from this study?
Yeah, when you first read the headline, it sounds surprising. And people who come down with influenza 6 times more likely to have a heart attack. But when you look at the study, especially performed in the Netherlands, they often do their flu testing on hospital inpatients. So that changes who we're talking about. It's likely folks who are older, who are struggling with their influenza. And then this starts to make sense because lots of times we'll see folks who are admitted for other reasons end up suffering a heart attack, likely because those inflammatory markers are up. It doesn't necessarily mean they have a large heart attack, but it's not so far-fetched as you might think. There was a Canadian study that showed something similar, that folks who are sick enough to get admitted for influenza, have that positive flu test, do have heart attacks at a much higher rate than, say, those individuals who manage their influenza at home.
I did find it interesting in the Netherlands. I mean, you said it, they only do flu tests in the hospital, so they're not like walking into the CVS there and getting a flu test. These are people who are really sick. Should those of us, I mean, most of us get the flu, we're not ending up in the hospital. Do we really need to worry about this then?
I would say for the large part, no. If you're a person who gets, influenza and you're doing okay at home, don't suddenly think you're going to end up having a heart attack. This is a much higher risk population who is already in the hospital, they're sick, and then they happen to have a heart attack in addition to the other things they have going on. So for the average person at home, probably not a big deal.
Yeah, good for medical professionals to know that do work in a hospital setting. Hey, speaking of heart attacks, some researchers are using artificial intelligence to predict cardiac arrest in the hospital. How are they doing that?
Yeah, so this is true, and I think we're going to hear more and more about, deep learning algorithms or machine learning helping out clinicians to identify people who are going to do poorly. In this study, they looked at over 47,000 EKGs, and they applied a machine learning algorithm to predict which ones would eventually result in cardiac arrest. And the outcome data is pretty convincing that this machine was able to identify folks who would have cardiac arrest. The big question in my mind is how much lead time do you actually get? Because if you can tell me 2 days ahead of time, I might be able to do something about it. But if you tell me 5 minutes before they have a cardiac arrest, that's a little bit trickier. And I think we will see these predictive algorithms become more common in healthcare, where clinicians who can't, looking at the patient, looking at the labs, make this determination, will turn to computers that are looking at hundreds of variables and will say, you know what? Bob might not be doing so well tomorrow. Maybe you should do something to him today so he doesn't get any more sick. That's almost sci-fi.
Yeah, picking up on things that are just so slight that maybe the doctor's missing, but the computer's seeing. That is fascinating. Hey, quickly, I want to ask you about strep cases. Parents probably know this, but strep really been high this year. What's going on?
Yeah, I mean, there's a couple different theories, but strep throat, we're seeing a lot of cases, especially in those younger kids, age 6 to 13, and those over the age of 65. There's some thought that being masked up during the pandemic maybe prevented a bunch of people from getting the strep they would have gotten. They're all getting it right now. There's some thought that maybe it's just a little bit more virulent strain. It's better able to cause strep throat, but we're seeing lots of it, so much so that sometimes the antibiotics used to treat it are in short supply.
To wash your hands, is that the normal things to not get sick?
Yeah, wash your hands. Make sure if you have a cough, fever, sore throat, you're not going to school or going to work so that you give it to some more people. But same stuff we learned over the last couple of years works for strep throat, too.
We still need to be reminded because some people are showing up sick at work. So Dr. Jeff Potoff from UW Health, I appreciate your time.